road after this. Up in the mountains.
Oh, there's no. Yeah.
There's some clouds over there. Yeah, my doctor said it's already snowing. Sorry. So as long as I miss the moon.
Yeah. The
Rush of everybody trying to fly, and it's already I'll see.
yeah. When it starts to get cold again.
I just knew you're getting ready for nurses.
Getting off those Zoom meetings, right? So we had almost 90 rooms. So we usually have 60% of that actually attend. So I'm guessing 50-ish, 50, 60 total.
Okay. And it'll dip up on me if I'm just right there.
Yep. So camera's actually up there. Green right down on you. Or so nicely, it's not right in the face. Sometimes we have these little kids that sit on the buildings, so they're like, it's a lot of but in here,
I registered.
mostly talk to us and it's good.
Yeah, that's good. I registered too, so I'm not even gonna be there.
You were here, you were counted. The 1202, those
Yeah, I
meetings
totally
rush.
understand. I'm always out of the room. I'm running back.
I tried for 4 years to get people to have meetings at 10 till. And since I can't get people to attend 10 till, I still start my meeting 7 minutes. Like,
I know, I also used to really enjoy that time when you walk. When you're excited, you leave enough time so you can get it.
Yeah. Yeah, I really yes. I walk across campus or even down the hall. Instead,
So you have a full-time records?
yeah.
What, so do you have a department or something?
Behavior medicine, planning department.
What's your?
Health and behavior sciences.
Okay.
Yeah. Okay. Perfect. Online today. Okay. There we go. The indicator choose you for 1 more week or. Which time she can. It's so weird when I can't see our Zoom. Welcome, everybody. Thank you for being here today. My name is Sarah Brewer. I direct the education program at Accords. And I want to welcome you all today to our seminar. For those of you who are not yet familiar with us, what is Accords? We are bit of a one-stop shop for pragmatic research. We're funded by the University of Colorado School of Medicine, as well as Children's Hospital Colorado. And we provide an environment for faculty to conduct pragmatic research, get various types of services and supports for their grants and projects. And we have really incredible mentorship, training, and education in health services. So lots of opportunities to grow in that space. I'd specifically like to highlight the second bullet here. We have I think 14 now, strong methodological cores and programs led by national experts in those areas. And I really want to highlight our mHealth and Informatics core today. Susan Moore has been instrumental in partnership to create this series. So thank you so much, Susan, and the mHealth core. A few additional things coming up. I want to point out we're about to move into the holidays, so we have a little bit of a break on educational events in the next couple weeks. But when we come back in January, we've got some really cool things coming up, and I hope we'll see many of you there. Next in this series is on January 13th, and we'll be hearing from Dr. Matt DeCamp on ethics and bias in artificial intelligence. And then that same week on January 15th, we'll hear from Dr. Ken Kawamoto as part of our Learning Health Systems Multiple Perspectives for Mutual Gain series. Then in February, we are offering a new workshop. It's on pragmatic research planning in partnership with CCTSI and CETA. And then keep your calendars marked. Colorado Pragmatic Research in Health, or the CopperCon, is coming up June 4th and 5th. And the call for abstracts is open now with a deadline of January 15th. So we hope to see some of your work represented at CopperCon. Okay. Just a couple of housekeeping items before I introduce our speaker and hand over the mic. Just a couple of things. First, if you are on Zoom today, please go ahead and use the chat and share your comments, questions, thoughts throughout the talk. We will have some time for Q&A at the end of the hour. And then second, please complete our evaluation at the end of the hour today. We really take your feedback seriously and try to incorporate that as we plan for future events. All right. The most important part today. Today's seminar is part of our Emerging Topics in Digital Health and Clinical Informatics series. It's the fourth in our series, and today we welcome Dr. Annie Collier. Annie Filterman Collier is an associate professor in the Department of Community and Behavioral Health at the Colorado School of Public Health. Her areas of specialization include the application of the arts and positive psychology in wellness program development and health messaging, community-based participatory research and engagement, and the use of digital health strategies for health and well-being, especially with Indigenous populations. So please join me in welcoming Dr. Collier today. She presents health equity considerations when designing digital health technologies. Welcome.
Hello, everybody. So I'm going to look at you guys because I know that there's a lot of you out there, but the room only has a few people in it. I'm definitely going to save time today to answer any of your questions and talk about things that you might be interested in knowing more about. Today, I'm going to begin by talking about what we mean by digital health and health equity. And then I'm going to spend some time talking about community engagement and co-design, which is absolutely essential if you're going to want to work in this area. And then a lot of different kinds of important considerations that I think are important to know about and think about. And then I'm going to talk about two case examples of mHealth apps that I've helped build, one from the ground up and one that I adapted that was already existing, both for American Indian and Alaska Native people, and talk about the pitfalls. So I really want this to be, and the strengths, but a lot of issues came up in both of them, maybe trying to share with you some of the experiences and what I've learned, and then drive to some of the points that I'll be bringing up earlier and talk about that in more depth and then answer your questions. So what do we mean by digital health technologies? I actually started this slide by having about 15 times longer definition and then decided to go with something simpler. And basically, there's just so many ways we can define it, but it's essentially using different types of technology and applying it in a health setting, whether it's wearable devices, whether it's telehealth and telemedicine and personalized medicine. And I've certainly had a lot of different types of experiences with this and more. And so it really would apply to what you're doing, I'm sure, in more unique ways. So hopefully this umbrella term captures it. And so what do I mean by health equity? It basically means everyone should have a fair chance to have the best health possible, regardless of race, regardless of ethnicity, disability, sexual orientation, gender identity, SES status, geography, such as being rural or other factors. So how do we level the game and make sure that we're providing people with the best opportunity to gain health? And I really hate to I really went back and forth on this slide. I guess to me, the most important thing that I want to do is at the bottom, the terms to avoid. I think we really need to be careful about talking about people as if they're vulnerable, marginalized, or high risk. That's very stigmatizing language. And I see this happening all the time when we're talking about health disparities. And that's also why I don't even like to use the term minority health, even though we have legal definitions of what that means, because it's all relative. So I've lived in a country where I was the minority, but I come back here and I'm not the minority. And we all have different identities and different ways that we could be also part of the majority, depending on where we live and the groups that we're part of. And so I feel like it's very stigmatizing to say somebody is more at risk or marginalized or vulnerable, because it also has a really colonialistic language, patriarchal language that really says, well, somebody else isn't, therefore somebody else is. So I just want to talk about the fact that I'm going to be giving you examples from my work with American Indian, Alaska Native people, but I know for a fact that a lot of groups of people would really object to having some of the language used as we described working with them. And I am obviously a white person, maybe it's not obvious, but I'm a white person, and I choose to work a lot with different groups where I am not in the majority with those groups. Okay, so I do want to emphasize again, and then I'm going to stop going into this in as much detail at all, is systematic racism. And that is also ingrained in our healthcare system. It is so ingrained that I think a lot of the digital solutions are potentially don't work and are flawed and not going to be as useful for people because we have these different mindsets. But basically in the US healthcare system, we want to use technology as a tool to disrupt that so that we don't have as much inequity. But the very way that we design digital solutions might also contribute to that. So that's what I hope you walk away from today, is just broadening the way you're thinking about how you're working with people and communicating with people so that we can use this. I first got really interested in working with digital technologies many, many years ago, but it really came out of working in environments where people just don't have access to healthcare or behavioral health care. And particularly, I'm a clinical psychologist, so that has worked in the area of health services for most of my career. So I really thought, how can we leverage technology? And that's, I think, part of what the important underlying message is here is, I think we can. I just think you have to have a lot of considerations about it. And so the last major point here is that if we have health disparities, there's a higher incidence and prevalence of disease, there's excess and premature mortality, there's greater global burden of disease, there's poor health behaviors and clinical outcomes, and there's worse outcomes on validated self-reported measures. So we really need to be thinking, that's what I'm, and doing the work that I do with digital technologies, this is what I'm trying to disrupt, are these types of disparities. There is a digital divide, and this is a really good paper, and I have the references at the end of the slides if you want to go back and look at any of these. But this is, and I don't want to go into it in as much detail, but they really talk about that the digital divide has so many levels that we have to think about. From policy and structural determinants, in the very fact that you don't have internet or broadband in high income areas. It's not accessible to all. I was at an NIH meeting, and I was on psychosocial oncology probably about 6 or 7 years ago. And an NIH officer was there. And to them, it was just, yeah, this is obvious. This is so great. You're going to develop technologies and work with people that have cancer. And I was like, you have no idea how sporadic the internet is in rural places. How, basically the level at which just because we have technology doesn't mean it's available. System level determinants, even people who design most of the technologies, the lack of investment in services in the infrastructure for people of color. So entrepreneurs of color receive 1 to 2% of funding for startups. So that means would they be more likely to be potentially aware of issues of health equity? Maybe, or maybe not, but even if they were more likely to, which I would assume they would, there's very few people that are in these areas developing it. Overrepresentation of white and Asian founders. Are they prioritizing health and innovation? They're prioritizing health and equity, and probably not as much in what they're doing. Innovation, yes. Community, social level determinants. So communities, they may or may not know about the benefits of technology and health. Are they even brought to the table to have those discussions? And have they even considered those issues? I think that a lot of times the answer is no. More often, what's happened to me in my career is people are like, this is a great idea. This was like the example with psychosocial oncology. This is a great idea, go do it. Like, wait a minute, I haven't talked to anybody yet about whether they even want me to do that. And do they even know that this is something that could benefit them? I have to have those conversations first. Individual level determinants, again, this will cut through all of my talk today, but the individual level determinants means, do people have the skills to use the digital tools and the platforms? And do they have the motivation? So another area that I've gotten into in some of my research is app stickiness. So for technology, you can build something really great. Will anybody ever use it after the first week or two? A lot of times the answer is no. But what are the individual determinants? Could you actually build that into what you're doing so that the community are interested in it and you understand what those roadblocks are? And then lastly, in the designers of the digital tools themselves, which I don't know who the audience is. I'm assuming that a lot of you are coming to this talk because you might be interested in doing that. You have to think about those things if you're the designer as well. Okay, so the benefits of the technology and using digital applications is that it can facilitate earlier and more effective physical and mental health interventions. It offers unique opportunities for monitoring people's health and mental health, collecting data, ecologically valid data, supporting self-management interventions where they're needed. It can help providers reach people who don't have ready access to healthcare. So there's a lot of ways and a lot of complex ways that this will be helpful. How did I get into it? I actually, I don't know if any of you out there knew me many years ago, but many years ago, I was here, my first assistant professor job at the medical school, and I was the head of psychosocial oncology before we were even a cancer center. So that shows my age. And I worked in the field of developing and providing services for people that had cancer to meet their psychosocial needs. And then I met a guy who wanted to finish his psychiatry residency, and he wanted to move to a little island country called Palau, which is in Micronesia. And my life trajectory changed completely. So I went from being highly specialized in what I knew as a clinical psychologist to working and living in a very remote rural place that had very limited access to mental health services. And my still husband and I were the main providers for those services for 2 years. And it completely changed my perspective. And so since then, it's always been, my angle has been, how do we develop programs? How do we work with people to provide access to services and train people in those places to provide those services? So those are common threads that have run through. So I have basically done a lot of work to build new and modify existing mental health substance use apps. That's something I'm going to share with you today. I've worked with integrating AI chatbots into substance use education, part of the program of what I'm doing now, right now here. Evaluating the acceptability and feasibility of using algorithms, particularly for me as a mental health provider, using suicide algorithms. And trying to see how that landed and whether people would be comfortable with it in a tribal health serving organization. I've done work with using virtual reality interventions for stress management and well-being. And probably what I still think is the most important, and what I learned many, many years ago in Palau, is community engagement. And how do we work with people if we're going to use technology in a way that makes it lasting, long-term, and a useful tool for them. So I do a lot of different kinds of technology work, integration. It's taken me many years to get here because when I first was interested in technology, I realized quickly that I didn't want to be the person who was building it. That wasn't my strength. My strength is in looking at and understanding what, how to assess what communities say they want, how to help them develop what they want, and then how to bring people together to develop it. And I write the content, I can evaluate it, all these other areas of it, but not the writer of it. So that's important to know. Okay, so then, as I was saying, co-design, I think, is absolutely essential. And there's a lot of different words for this. Basically, if you know what community-based participatory research is, then you're ahead. But essentially, we have to use participatory methods with people, the intended users at every stage, from the beginning to determine what is the feasibility and acceptability of it? Do you even want it? I have another grant that I'm working on right now, a revision that somebody had originally submitted, and now I'm helping to revise and resubmit it. And they didn't ask people ahead of it, wasn't built in to say, do you want this technology? And that was one of the things that NIH was like, well, how do you even know they want it? And it is such a valid question. And even if you think that a few people want it, you have to ask many people and make sure they want it. Then you have to think about the research design. What's practical? Then how do you implement it? How can you make that happen? How do you evaluate it? And then you have to refine it as it matures and go back and interact with people. So really what's important here is thinking about building relationships. If you haven't done that before, there's a lot of different people, both through Accords and at the university, that can help you with how you do community engaged work. But it's really an important part for you to be successful. And in terms of funding, that is something that NIH and NSF looks at, is can you demonstrate that you're learning about that and know how to do that? You need to understand the motivations and challenges that real people face, including special circumstances or requirements of your target group. And you need to incorporate language, values, and knowledge. And I'm going to tell you about one of the groups I work with right now on developing a mental health app is with Hopi people in Southwest US. And there's differences by generations, even about what people think are some of the traditions. And so you're going to find that even within different cultures, people may have come to the US at different stages. They may have been here longer or shorter periods of time. They're going to have different perspectives on what that culture means and how they interpret that. So that's really important. Okay, so again, why is co-design essential? Basically, underserved communities typically have experienced marginalization. They are not going to automatically trust you just because you're there and you want to help them and help develop stuff. It takes a lot of time to establish trust and find out what they need and what they really want. I spent about 8, maybe 6 years when I first moved to Northern Arizona, which was one of the main position I had before I came here, working with a couple of people that I really connected with that were Hopi and Navajo, and wanted to talk about what I could do at that point to develop programs for them. And they just said, well, you're a clinical psychologist. Can you please do a support group every month for us? 6 years of doing a support group. I can't tell you how much I learned by doing that about what the real issues were and what was going on. So I'm not suggesting it's going to take 6 years, but it took me a long time. I still work with this one person today. It's been 15 years. She trusts me because she saw that I listened to her. She got to know me in a different context. So it takes a long time to establish trust and find out what people want. Many marginalized groups of people have experienced unethical research practices. You think, like, you may have heard about the Havasupai tribe. I don't know if you have or not, but essentially that was a major ordeal in Arizona, and it's affected IRB protocols. But essentially people collected data, had an agreement to collect data for some genetic testing. Somebody else came along, and I'm really simplifying this, and said, I'm interested in knowing about something related to sexual abuse. And they ended up finding out that many people were related to each other that shouldn't have been. And it was probably because of sexual abuse that had been going on. And they never had approval to use the data that way. And so it's led to all kinds of different practices. It's really horrific. And if you're in certain regions, you'll hear about this a lot. But you think that's removed and people may have heard about it. I worked with a group of people that will obviously go unnamed that ended up taking voices of people, putting them in an AI program, and then having the AI program recreate meditation scripts that were then used as a research study, but they never got permission from the people whose voices they used that were American Indian to use it that way. It's a really slippery slope that, you know, colleagues don't all have the same understanding about the complications of using AI and like where you need to get permission. But the level of trust was broken when that happened. So there's a lot of probably more subtle ways even that trust has been broken over the years in a lot of groups of people. People want to come in and do something, but it's also for their benefit to get grant funding, and they don't necessarily give back to the communities. So this is really critical. Do you know what the community's strengths and resources are? This is another really, really important thing. I can't tell you in working with American Indian populations how tired people are of hearing, oh, we're vulnerable. Oh, they're marginalized. Oh, they have so many problems, when there are still so many strengths and resources that exist in different communities. So this is mostly my example right now, but I think it applies to a lot of different people. So I really want to encourage you in whatever you're developing and thinking about to be thinking about strengths and not just pointing out the weaknesses, whether you're talking with the communities or on behalf of communities. Even if you're not part of that community, you always have to think about strengths and resources they have and build that into whatever you're designing. And then your intention should be to leave what you develop, so that this gets into the whole issue if it's for profit. But it should be to leave whatever you develop with the community, empower them, build capacity so that they can continue to use those resources. That is just, I think, an underlying ethical imperative that we all do if we're working with communities and helping with this digital development. And you're not going to have any ability to disseminate it and then carry it forward in the future if you are not thinking about all these levels while you're designing it. Okay, so this is just a practical thing. I decided to put this in here. So if any of you are going to be working with different communities, I think our typical approach is to set up a meeting and go talk to people and find out, ask them questions and start designing, right? I really want to tell you to slow down and to think about how to be more creative with what you're doing. You need to, and I'm not saying we need to play a game of icebreakers and ask you what your favorite season is, but we need to think about that. Sometimes that is actually not a bad idea to do that. You need to take your research hat off, and you need to be real, and you need to talk to people and provide people with additional context about who you are. How come you're motivated to do what you're doing? And include some of your non-academic identities of who you are. When I was living in Palau, people didn't trust me until I finally became pregnant. And from my Western hat, that was actually kind of like, are you kidding me? You know, I'm in my like mid to late 30s and I finally have a kid, and that's not my identity. I've been all these other people in my life, and that is still who I am. Why just being a mother means something to you. But in that context, that is what mattered, that they understood me differently in my different roles. And I think that was a really important lesson that I learned, that you have to be real and connect with people, especially if you're entering communities that you are not from that background. And then think about doing things besides talking. Like when I worked with a group of American Indian youth, we wanted to know, what did they think? Again, this was all towards building an app. We wanted to know what they even thought health was. Well, I can tell you how successful I was, not successful, sitting down and talking to a bunch of American Indian 10 and 11-year-olds. I was an older white lady, and they were intimidated by me. They couldn't relate to me at all. But I gave them a bunch of cameras, and I said, go spend an hour and take pictures. And you're in these groups, and go take pictures and tell us what you think health is. They came back, and it was a really different kind of discussion, much richer. So these are examples of things that you could use. Zines, which are actually, there's a talk on that. I believe it's this week that's happening from Cayenne. And using collage to ask people to talk about things. Card sorting to establish priorities, come with different things. Rank order theoretical and cultural strengths. Provide interaction time with prototypes, show them what you're thinking of developing. We actually have, in different situations, have given people a picture of a phone and told them to draw what they wanted to see on that phone. Be creative, basically. So again, if you're thinking about entering communities and working with them, you need to think differently a lot of the times, not just be so goal-oriented that you're moving forward the same way you always have. So co-design often takes time to develop relationships. There's an example is the NSF Smart and Connected Community. They will give you well, we hope they'll continue to give us all money, $150,000 as part of the development of then your several $1 million grant in the future, that they will take on projects that they think hold promise, but they want you to build those relationships and demonstrate that you can. And there's smaller grants at NIH that also do the same. We also have grants even through the CU system that will help you build relationships with communities and take the time to do that. So it is not a part to push past. Okay, so now what I want to do is talk about challenges in design before I go into talking to you about some of the examples I have. Again, the target population is critical to make sure that it's relevant and interesting to them. So I'm putting it here, I put it there. It's like co-design is critical. Second is you need to think about health literacy and digital literacy. And health literacy seems really straightforward, but I at one point was working with a refugee population in the Midwest that were from that were Hmong, and we were trying to understand what was happening with why they didn't have people go in to get behavioral health services. And through the community engaged work I did, we realized totally different vocabulary and understanding of mental health, or when you go to the doctor and what you go to the doctor for. And a lot of that, and I'm not going to go into it in a lot of depth, but a lot of that was steeped in their understanding and their language. So you may, when we talk about health literacy, it may mean to you language, and that we have things written at a 5th grade or a 7th grade language, but it could also be really complex and deeper than that. It may be that somebody who is schizophrenic is actually revered and very spiritually gifted, and that's not considered a mental health problem. There could be so many different levels at which language and cultural understanding leads to a different health literacy. So I'm not giving you a lecture on health literacy. I'm just asking you to think about these things, because there may be a really big disconnect in people's understanding about what you're trying to accomplish. But also digital literacy. So, you know, I know from traveling in Southeast Asia that were internet cafes 25 years ago, and people had access to computers and cell phones way before we even had access. But do they use the digital, the phones the way that you might use it? Do they use the computers the same way you do? One thing that just happened recently with the app that I'm working with in the first several trials of it, is we couldn't get people to, because of security measures, we wanted them to have a sign-in process that they would use their email to validate their sign-in on the phone. But we couldn't get them to go get their email and check their name and then press the button and then go back to their phone, because they didn't use email that way, and it was too many steps. They didn't understand why. They didn't remember their email sign-in. So here we've got a lot of youth that have telephones that when they have an internet connection they use, but they don't use it the same way. So digital literacy may not happen the way you're expecting it to, and you have to take time to understand that. Okay, technological accessibility. This seems like a no-brainer, which that not everyone has access to smartphones or live internet, and that could be a barrier. But I've made this mistake before too on several different studies I've done. So I'm happy to talk to you about the failures. Went back to Palau, tried to build a text-based obesity interventions so that it could leverage that while I was not in Palau and I was back in the US. Basically decided, well, they don't have phones, we'll buy them for them. And guess what? We lost all of the phones. And it wasn't that people, I think, were trying to steal the phones, but they didn't necessarily value the phones the same way that we did. They also could use it in other contexts, right? They lost the phones. A lot of things could happen. So, and then also technology can be outdated. That's happened to me too. So, okay, we'll buy the iPads for people. And then by the time we actually have something relevant, it doesn't work on that model anymore. So, you know, it seems like, okay, well, if the solution is they don't have it, we'll give it to them. Is that going to be sustainable? Is that really going to work? And is that the best long-term solution? Additional challenges, physical abilities. This is another one. I can't tell, I think this is getting better, but I can't tell you how many apps don't even have the ability to change colors or to change the way it looks visually. Like making it larger, I could probably do that on my cell phone to make it larger, but people may not have the skill to do that as well. So I think trying to think about accommodations, I think that that's responsible computing technology is that we do that, but I think that's not your goal and you're trying to develop something, you may forgo that. Security and privacy, breaches and data happen. So it's really important to secure and protect data. There's going to be a lot of mistrust in sharing information. So that's another thing I see all the time is that people, like you may need to use an email to sign in, but they don't want you to have access to their email. They don't want people to know that they were part of this study or part of this plan. So in other settings, we actually create emails, dummy emails that we use with passwords for people to use. Then you can't do that authentication system that's built in. But security and privacy is really important, and that's something else you need to think about. I mentioned user retention and stickiness. I think this should be on your mind from the very beginning. People don't want to just be kind of, oh yeah, we're part of this shiny new object. You're going to make something and then you don't really care about our community and it's not going to last. I don't even use things for long term. I've signed up for meditation apps that I may try 2 or 3 times and then I never use them again. Not just talking about apps, but I just want you to think about long term what you're developing. I also think you need to break away from this individualist Western concept that we're designing something for people that's going to be just for them. Another example, again, because it's really on my mind right now, in designing this app that we're developing for Hopi youth to try to build resilience skills, we're having a hard time, and it's not to say we won't continue we won't eventually be successful at it. Having a hard time getting youth to sign up. But guess who really want to sign up for it? Parents. And so then our team was like, oh, I don't know, this isn't for parents. You know, we designed it for youth. But if the parent wants to use it, why not? And why not, if they're going to get better at the skills, wouldn't they then support the youth in using it? And furthermore, people then living in smaller areas, their friends and their families that live close by, their relatives want to use it. So think about the individual group, not just the individual. Also, another interesting part of the design process was the adults were like, yeah, we're not competitive. We need to do things as a group that support each other. We don't like these, go out and kill them and beat them up type of computer games, for example. But you ask the youth what they want. They want the games where they're getting the points and they're beating each other. So we had to really think about that in our co-design so that we're meeting the needs of the general culture around what they also value, but that the kids are growing up in a Western world and they play these kind of games and that's what they really want. So how do we make it Hopi, but how do we also make it so that it's appealing within the culture? And then I mentioned this with outdated technology. All of the materials need to get updated and changed over time. So these are just kind of throwing out their different things. Okay, cultural considerations. So we want to do the best that we can to incorporate ecological knowledge and social values, but these are not necessarily well agreed upon. So, and try not to make assumptions that because a few people have told you they were, that they are for other people. So one example in my building, what is the content that we're going to put in the Hopi app that we were developing? I spent 3 hours one day with hearing people's different perspectives about how you define what Hopi is. And I didn't walk away with much for my app that I could actually translate into. But I did walk away with a complete respect for how complex this is, how confusing it is for multiple generations to define this. I walked away with a much better understanding as an outsider of Hopi culture. But there's going to be a lot of inconsistencies with how people talk about their culture and what they think of it. Another thing is be aware, this is just practical things intermixed with broader things, but be aware of special holidays, special customs and traditions. They will impact all of what you're doing. So again, with Hopi as an example, right now is a quiet time of year. And so that may sound from a Western perspective like it's cold, we're inside, we're quiet. But there's very deep beliefs about what the earth is happening in the earth and that it's got a very thin crust and we have to protect the earth right now, not harm it, not harm the spirits. And we have to be quiet. They stay indoors. They will tell stories, they'll have food, they'll share things internally. Therefore, they don't want us coming out working on the app this time of year. And all of the things we build have to take into consideration seasonal variety, because that is really important. You do different things at different seasons. So when it's harvest season, we can't get anybody to come to any of our meetings either, because they're really busy doing a lot of different traditions at that time of year. Again, a lot of my examples right now are coming from here. I've worked with multiple groups, and there are a lot of different kinds of understandings of this. On here, I also have, okay, I've got to speed this up. I just looked at the time. Post-colonial and decolonial computing. The impact of colonialization has taken its toll on so many levels, and it is part of who we are as researchers. We represent the colonialistic perspective, and we have to think about that. Data sovereignty, can I say that word? No, I can't say that word right now. NIH is going through a lot of attempts to try to understand how to let tribal communities, for example, own their own data and not make that part of what exists for everybody to have access to. But there may not be the infrastructure in any of these areas for there to be IT departments to help you to understand what an IRB protocol is. There's no technological expertise. Some of these ideas are very theoretical when you get down into the practical world. Okay, I am going to, the last thing on here that I want to point out before I give you some brief examples is historical trauma. This is not just important for American Indian communities. This is important for multiple communities. And if you are not necessarily part of the majority community, you have experienced trauma, and your people before you have experienced trauma. It's really important to understand this, because when I talked about trust in the beginning, this is what it all comes down to, is how can you be respectful and develop trust in communities, especially if you're coming to the communities not representing who they are, you're working with communities. And there's going to be a lot of reactions to how you come across and what the organization, such as the university, for example, represents, and how people have been harmed by institutions. So that is really important to get information on and to understand. Okay, I want to tell you, and like, I want to save time, so I'm going to take about 5 minutes and give you some highlights from ground up versus adapting an app and what happened with it. And I think the term cultural adaptation carries something that I want to also warn you about, carries the same kind of problem as vulnerable populations, because it still has that colonial patriarchal approach of saying, we're going to take what we know works here and we're going to adapt it for you and make it work for you. Well, can you even do that? Because is that going to work for everybody? And in fact, just because something is evidence-based in a white, heteronormative culture does not mean it would actually, it's ever been tested with different groups of people in other environments. So just because you're coming to the table saying, I've got these skills I know work, for example, in mental health, it doesn't mean that it's going to be effective. And I also want to say, think about strengths on asset-based approaches. This is critical. So the Kwayanaktu, and I'm butchering the language, we often call it QI Hopi app because of people like me who can have a hard time saying the language correctly. We basically wanted to say, how do we build an app for your youth that would be useful? And of course, mindfulness was the one that we grabbed onto because that sounds like it would have application. And it really wasn't necessarily meaningful and understood very well by a lot of people. So just again, because an idea means something that you think could work doesn't mean it necessarily will. Cultural preferences and needs related to mental health. Well, people had historical experiences with mental health that were bad, even with mental health services on the reservation or off the reservation. And there was a preference for Hopi cultural ways, which I have nothing about in my textbooks to help me understand what does that mean for how we design an app. They wanted everything to be culturally grounded with theory behind. I wanted things to be culturally grounded with a theory behind it, but as I mentioned already, I couldn't get people to decide what that meant. What did culture mean? And different beliefs about religion. This happens a lot with a lot of indigenous people, is that you've got a really Western colonialist religion, and then you have traditional beliefs. Some people will cross over and be interested in both. Some don't want anything to do with the other. And so people wanted prayer, for example, in the app, but prayer had a really different meaning for people. And there's people that are Hopi that are also agnostic and atheist. So do we even go that far and put prayer in the app? They wanted artwork and imagery. They wanted it to have Hopi language, but differences in how you say words. They wanted activities that involved cooperation and support. But again, as I said, the youth wanted something different than the adults. They wanted a peer mentor program because youth told us they like to talk to youth, not to adults. But we've had difficulty getting mentors to show up and be mentors in the app. So again, there's a lot of practical things you'll face. These are just a couple pictures from the app. We had all of the art was built for us by people working with Hopi artists. Even the butterfly, the pattern that's in here, you can see is very, has a lot of Hopi symbols in it. We integrated team running into the app. That was a group activity, so that was one way to have cooperation. But Hopi running is a very spiritual activity, so we integrated that as well. We had meditations that we developed for different seasons. Everything had to have verbal explanations, and my voice, I've many years of doing audio recordings for meditation and hypnosis wasn't going to cut it. I don't think I hear an accent in how Hopi people talk, but they heard my English accent. And we have Hopi people that are actually providing that. SOS button. So these are just kind of give you a flavor of the app. All of these are Hopi resources. Okay, so then another approach, which actually came first, this I did before I did the Hopi, was let's take in a pre-existing app and help modify it for people. And in this experience, we ended up wanting, it was for Alaska Native people that were exploring sobriety. And there's an existing app that's called Connections. It's part of Chess Health, and it's a really good overall kind of app that provides a lot of different types of things for people that are trying to be sober. And so for South Central Foundation, which is the organization I worked for, we basically paid $30,000, and the company said, yep, we'll work with you to modify this, and then you can have access to it and use it for your organization. You can still see some of the stuff to this day that they say they work with tribal health organizations. But what happened in terms of taking off-the-shelf app didn't go really very well. And basically, they went through one iteration with another company that was even worse, and then they went with this company. Again, I think this is I actually did a review paper of mental health apps, and this is one of the better apps that are out there in terms of what they include. But how do we want to adapt it? We wanted to curate, modify, add special contents that were relevant for Alaska Native people. They wanted to integrate a community reinforcement approach because they had data to show that work with Alaska Native people. They also wanted it a closed system. So one of the benefits of this Connections app is that they have mental health and substance use counselors available for people all 24/7. They have skills in this. They did not want their people subjected, the people Alaska Native people subjected to being in the larger community across the USA because people had experienced what? Distrust, discrimination, abuse. They basically wanted it to be more Indigenous focused. And there were many things we couldn't change in the app, the look and feel of it. So when you look at the Hopi app, you see all of the imagery in the background is really different than when you look at the Connections app. Basically, all smartphones are not equal. 2/3 of the people that signed up after we had modified this couldn't even access the app because their phones were outdated and it wouldn't work. It was very grounded in Western ideology, not Indigenous beliefs. And there were also very, very little information and special groups available for people even that were LGBTQ, that were American Indian and Alaska Native. There was no like diversity in what they were offering. They did updates that overwrote all of the modifications that our team had done, even though they said, yeah, you can contract and do this. We did it all. They did an update, pushed the button, and it wiped it all out. And it took us months to get back and look at that. And then in the contract, we're like, you will not do updates without telling us. And like, sure, we won't. And it's like, did we trust them again? No, we didn't. So then we had to back up everything. The team wanted, Alaska Native people wanted additional features. They couldn't be added into it, like journaling. And then when they weren't pushed to the top and promoted like their other things were. We couldn't turn off a lot of their features. So if somebody pressed the SOS button, like you saw in Hopi, it went to their mental health providers and substance use counselors and not to us. And then they had people that they didn't know contacting them that were using the app. That led to a lot more distrust, right? So we basically had so many of these kind of confusing things that happened that nobody knew. We couldn't sign them in to accounts because they needed all these authentication systems that wouldn't work if we made up emails. And it was very poorly set up for individuation. So basically, so I want to go to questions and comments now, but basically I didn't have a lot of success with it because it was, they wanted to be flexible and they wanted to adapt it, but there were too many levels at which, whether it was visually, whether it was like values wise, we couldn't take out what they had that people didn't want. So I'm going to stop there. I'm happy to answer any questions about what I've done in the past, but also if you've got any applications you'd like me to think about.
Thank you so much. I'm bringing my computer because I can track chat while we're chatting.
Okay, that sounds good.
I am really curious, especially with this last example you ended on, what like advice, or if you could go back and do it again. I think you bring up the point of like, there are tons of apps out there that have a lot of evidence behind them. And I think there probably are some opportunities to do good work adapting those for various contexts or populations. What would be some of your like first step, different approaches you might take to make use of that, huge body of work, but maybe avoid some of the pitfalls that you ran into?
It's a good question. So one of the things that the team did at SCF, South Central Foundation, before we did this, is they actually showed everybody the app. They showed what called customer owners instead of patients at South Central Foundation. What do you like? What do you not like? What do you want to see, not see? So they knew what they wanted and didn't want. And the company said, yep. And so I think I would actually be a lot more cautious. And so do your work with your communities, but I think I would be a lot more cautious and have contingency plans about how much control you really have before you sign that contract and before you really work closely, because even the team we were working with, they were fantastic at Connections. Really respect them, but they didn't even know some of these things couldn't be turned on and off. So I feel like some of this is in the details you won't know till you're in there, but the more you come to informed in the beginning. So the second year contract looked really different than the first year contract in terms of what we specified we wanted, how we wanted it to work, and also our understanding of the limitations, like people's phones.
Well, it sounds like even vetting apps in advance, right? So
yes,
doing a little more of that digging and maybe pre-work
Yeah, I think
before
s-
diving into like, we're gonna partner, but like, okay, well, let's test out how many of these things can we actually change
Right.
before we sign on.
I think the Hopi app, in the future, understanding what I do now, like, so here's 10 things I could change about this. So if I was going to work with a different American Indian group,
Mhm.
but I feel like I now have control over those 10 things by not owning and
Mm,
working with the pre-existing app. You don't have as much control. So I'm leaning towards the side of, can you just build it from the ground up, knowing that you want it to be transferable and adaptable in other situations?
Yeah.
Or really having a conversation with the company who owns it about where are their hard lines of what they can't change.
Great. We have a question in the chat. This is from Stan Zeffler. In your opening remarks, you mentioned terminology not to use in describing a population. But for writing grants, we often need to be really specific about our study population. So what terms do you use that assure a reviewer that you really know what population and can define that well? How do you incorporate some of that more inclusive ways of talking
It's
about
a
populations?
really good question. So I think an example is about 8 or 9 years ago, I assumed that Native American was the term, and I do not know any American Indian people that use that term. And they also fall back on the fact that American Indian is the legal term.
Mm,
Okay, and I'm getting to this answer, which is most tribal communities, as an example, prefer to have people call them they're Navajo, or say what the tribal community is, instead of using broader definitions. So I think you need to basically establish in the grant what convention is and what your community prefer to be called. And then set that up as then the language you're going to use. Because I think sometimes the legal language doesn't mix with what the common language is. Like South Central Foundation, people do not like saying Native. You don't say Native, that's not okay. But I see lots of published papers where people say Native. So I think it's understanding how people prefer terminology they prefer, and then trying to use that respectfully and defining that in advance.
Do we have any questions here in the room? Okay, excellent. Is there anything else you want to make sure to share today before we wrap up?
Just that I think that it is, again, the co-design is essential, that you need people from the group that you're working with. If you're not, even if you are part of that group, I've also felt like people will speak on behalf of others, that they still are not capturing everybody. It often involves having community advisory boards and carefully thinking about who you're asking to have input in addition to talking to people individually. I think those are really important. I do have some references. These are a couple of them I'm on, but these are not, there's yet to be one or two really good papers that talk about this whole issue and how you design. I'm more than happy to talk to people individually.
Well, thank you so much for joining us
Welcome.
today. I'll remind people to please complete our evaluation. We really do appreciate your feedback and input on today's, but also in terms of what other topics you would love to hear in the future. So thank you,
You're
everyone.
welcome. Yep.
Stop trapping. Jody usually makes sure we're all set.
Okay.
We got a bunch of thank yous and great presentations coming in the chat too.
Was there any of us showing on that?